CEO of Midland Health, and this is our Unified Command Team briefing for Tuesday, April 21st, 2020. And we've had a little bit of technical difficulty this morning, so I think we're working off the hospital's Facebook Live feed, and we'll be manipulating that throughout the briefing. I'm going to skip the Texas numbers, as I know the health department folks will be on in a bit. Getting to the hospitals information, we have now tested over 1,200 people, 72 positives, over 1,000 negatives to date. Still waiting on quite a few results, some of those as early as last Thursday, but the majority of them just in the last day or two. In the hospital, our census is 128 today. We saw 90 patients in the emergency department yesterday, exactly half of the number we saw on this day in 2019. In critical care, we have 13 patients. Persons under investigation, there are a total of 26. 8 of those among that 13 critical care complement, and then 18 others. 7 of those 26 are known positives. We have 8 patients on ventilators this morning. We've got some things happening now with regard to our response to the governor's new executive order that takes effect tomorrow. As you all know, we've been restricting elective surgeries for several weeks now. We are actively discussing a return to elective surgery, but as we'll talk about in just a moment, we've got some growth in our case numbers locally, and so we're moving slowly toward a resumption of elective surgery. What we are going to do beginning tomorrow is start slowly back into doing elective endoscopy procedures, colonoscopies primarily. Our 3 local GI physicians are working with their patients to begin returning to those regular schedules as soon as tomorrow, and we expect that to ramp up over several days. We also are releasing the restrictions on the majority of our imaging procedures, including screening procedures, and so for the most part, imaging will be open for business tomorrow as well. We have developments in the community with regard to further infections. As you all I know have heard, the Midland Medical Lodge continues to be a location of some concern. We sent our team out there on Friday and tested all of the patients and the majority of the staff. We got results yesterday on a large number of those patients. There were 16 new positives that resulted from our testing at Midland Medical Lodge. 14 of those were residents at that senior community. And we do expect more results to come in today and perhaps tomorrow. On the positive side, on the good side, we had 19 negative tests returned as well. So there's no question we have our first really significant cohort of patients in one location at the Midland Medical Lodge. Our medical and infection control teams are in contact with them regularly. They are isolating their patients as much as they can, and as they need hospitalization, they're coming to us. And as of this morning, I think we have 6 or 7 of those in-house. So that's a continuing concern that we'll be observing, and we will be conscious of that outbreak and the potential for large numbers of patients as we consider whether we return to elective surgery in the near term or not. What's being asked of us by the governor, what we will continue to do in consultation with our surgeons and anesthesia providers, is to be conscious of our ability to safely do elective procedures, to do them without unduly reducing our supply of personal protective equipment, and to be sure that any cases that we do don't hamper our ability to care for COVID-19 patients as those numbers potentially grow in the days ahead. One more area of concern. We became aware a couple of days ago that there were a number of Easy Rider bus drivers who had tested positive. We sent a team to the central Easy Rider location last night, and we tested 26 more people. We expect to get those results in the next day or two and determine if there's any further guidance we need to offer the Easy Rider team with respect to managing their infected employees. So those are major developments. I'd like to offer some thanks today to one more group of our hospital team. This is our schedulers and our insurance verification financial clearance team. You can imagine that throughout this process we've gone back and forth between scheduling cases and canceling them and rescheduling, and we're now starting up scheduling for endoscopy and other areas today. It's been a tremendous challenge for those folks to keep up and communicate actively and accurately with our patients every day, sometimes multiple times. That's a difficult and thankless job. Our patients have been very understanding so far, but I would like to thank our team in financial clearance and in scheduling for their hard work to keep us on top of the changing landscape we're facing these days. So with that, that's the end of my prepared remarks, and I'll be happy to take questions from the hospital's perspective.
We have a question on Facebook. When will Midland receive the 15-minute test to check for COVID-19 that the president said is out there?
I suspect that question is about the Abbott point of care testing. There has been some information over the last couple of days that the two hospitals in Odessa have now received test kits for their Abbott machines. Midland Memorial does not have the Abbott point of care testing machine, so we have no reason to believe we'll be getting those rapid turnaround tests anytime soon. Once we heard yesterday that some test kits had been delivered to the Odessa hospitals, we began more actively reviewing to see if those machines were potentially available to us. But as of now, I have no information about that and no timetable for adding those tests.
And then a question from the MRT. They ask, is there a need for extensive testing at other senior living centers?
I think that's a regular debate that we will continue to have. The reason that the extensive testing happened at the Midland Medical Lodge was that we became aware that there were multiple patients there, both some who had tested positive and a significant cohort of persons under investigation. We began to see patients being admitted to the hospital from there. So we took those as cues to get more actively engaged. I know there's been more testing done at a couple of other local senior communities, but until there's an outbreak, until there's an indication that there is an infected person, I don't think we have any plans to do broad-scale testing. We are in regular contact with those nursing homes. Our case management team has done a survey of all the homes in the region and gotten very good positive response from them, gotten pledges from all of them to communicate regularly with us, and we'll continue to do that so that if they begin to see signs of an outbreak, we can try to intervene quickly as it's needed.
We have another question on Facebook. Do you know how many people in Midland have tested positive but don't reside here? For example, oil field workers that work here 2 weeks and then go home to another county.
It's a pretty small number that have tested positive here but live elsewhere. Can I say the exact number? Not with great certainty, but I can tell you we've got 72 positive results that have come through our own testing, and the county has reported only 64 positives who actually live in the county. So that's 8 difference. It's probably in that ballpark. Relatively small numbers of people who are tested and end up positive in our community but don't actually live here.
We have another question from Facebook in regards to the Easy Rider buses. Do we know if those buses are being deep cleaned or sterilized in any way?
That might be a question that someone else perhaps from the city could answer. I don't know anything about the Easy Rider activity and how they're cleaning the buses, how they're managing their staff. Certainly that's something we can find out and perhaps be prepared to provide more briefing on tomorrow if no one else knows the answer to that question. But I don't know at this point what exactly their procedures are.
Okay. This is from the MRT as well. Was the larger number of positive cases at the lodge expected?
Well, we don't know exactly what to expect. That's why we test. But we tested about 100 people over there on Friday, and we knew that there were several positives already present, both among the workforce there and among the residents. So I can't say that it's surprising at all that there were a number of positives. And not all the results are in. We may see some more positives before this is finished. So I would not call that a surprising result.
And this is from Mitch with Marfa Public Radio. When did Midland Memorial Hospital become aware of the initial staff members testing positive at the Midland Medical Lodge? Should there have been a testing team dispatched earlier to the nursing home, since we've seen the coronavirus spread quickly among its residents?
I don't know exactly when we became aware of the first positive there. It was several days ago. Should there have been a team dispatched more aggressively? Certainly we can second guess ourselves. I don't know that it would have made a lot of difference in the management of those patients. It might have, so certainly you could suggest that we could have moved more quickly once there was a known positive. And I think each event we have, we learn from. I think as should we see the beginnings of another outbreak in another nursing home community, I think we probably would move a little bit faster. But recognize that this is an outreach that the hospital is doing primarily because we're concerned that these become hospital patients later on. This is not fundamentally our responsibility to do community surveillance and those kinds of things. We're trying to be good team players. We're stepping in and assisting with the health department's needs for work in the community, and so we're sort of learning how to do that as we go. This is totally new territory for us. So sure, I think you could second guess and suggest that we could have moved in and been more aggressive sooner, and we probably will the next time evidence of such an outbreak appears.
And how many nursing home residents who are hospitalized are currently on ventilators?
We think maybe one. I don't think that's a piece of information we have readily available. Sorry.
We have a question from Facebook, actually two with a similar question, so I'm going to lump those in together. Regarding the positives that we've tested, do we know how many of those were asymptomatic or, on the flip side, exhibited symptoms?
Well, for the vast majority of the testing we've done has been on symptomatic patients. When we went into the Midland Medical Lodge, we did test a large number of asymptomatic patients. How many of those turned out to be positive? I don't know. Do we have that level of detail?
The ones that they had in quarantine, there was about 13 in quarantine, and those would have been quarantined because they were symptomatic. So those were tested originally. So the 16 that came back yesterday were not quarantined.
So that's a good point. So essentially, all of the test results we got back yesterday were asymptomatic, because the ones that had symptoms had already been tested prior to that before our team went in. So appreciate the clarification from Dr. Wilson off camera there, but that's a good point.
We have another question from Facebook. What info do you have on the plasma research, and how high is your confidence in this research?
That might be a good question for Dr. Wilson to come answer directly, if you would like.
Good morning. Thank you, Russell. So the question is relative to the convalescent serum, I'm assuming, the plasma therapy. And well, all the research related to plasma therapy remains observational and small studies. We're gaining information in the United States on a daily basis. It's being used regularly now. We've used it here now on 2 separate occasions. And I think the information that we've gained so far is favorable, but there's, again, longitudinal information that needs to be gained. The patient has an initial response, but how do they do long term? There's other factors that play into it. So at this point, I would say that we're pleased with the benefits that we've seen and that we've read about, but I think the information remains early, and there's a lot of opportunity for other therapies to come along while we await the vaccination and herd immunity to develop over time.
We have another question from Facebook. Do you know when elective surgeries will begin to start?
No. The short answer is no. We don't know yet. We had hoped that we might start some this week. We have postponed that in light of the significant outbreak at the Medical Lodge and our need to be certain that we can respond appropriately to that before we begin large-scale surgery re-implementation. We'll be talking to our surgeons again tomorrow, and we'll set parameters for what the return might look like and when it might happen. But as of now, it would be speculating to say when. I think with some confidence it won't be before next week. Today we do have plans in the works to start endoscopy tomorrow and to open up the majority of our imaging procedures, but surgery is still to be determined. And by the time we meet on Thursday, I should be able to offer a plan in this next session of the Unified Command Team briefing. Okay?
That's all we have.
Very good. So we're going to rearrange our setup here while the next speaker comes to the podium. Let's see, hold on, before we move, Dr. Wilson has I'm sorry, I'm getting ahead of myself. Let's keep this in place. Dr. Wilson's going to make some comments, and then we'll rearrange. Thanks.
Thank you, Russell. So I wanted to provide just a little more information with regard to what we've seen with this hotspot that's developed in the long-term care facility here locally, and the concerns that I think a lot of people have, including ourselves, about what's going on there. But if you look overall at what's been going on in Midland, what we were speaking about before the Midland Lodge was that we were in a slow burn, and largely through the community we remain in that slow burn. We've kept the dampener on the growth curve with the disease in our community, and I think the social distancing and the work that everybody has done, city, county, the Unified Command, it's been effective, and we've done a good job. But we've always reminded everyone that there's a vulnerable population out there, and the elderly and those with underlying medical conditions are at risk. And unfortunately, it got into one of those sites, and that's what we're seeing. So we went from 42 confirmed cases last week, and then from Thursday to Monday, we got the results back on Monday, and all those results come back with a 20 or plus more positive tests, and it looks like there's been this accelerated growth. So that's really related to a hotspot in our community, and the work that I think the health department has done, Midland Health has participated with, and the city has kept our fingers on the pulse of that and trying to get it under control and work with the Midland Medical Lodge to do as well as they can. Favorable note to that is that with the population that we've seen through the hospital, the vast majority of the patients remain at the Midland Medical Lodge, either in quarantine there or even asymptomatic, and that's very good news. So we go back to the statistical information that we have going way back, that 85% or so of the population are going to have minimal symptoms, asymptomatic, etc. 15% are going to get sick, and a small percentage of those get really sick. And we're unfortunately in a population that's going to sway those statistics a little bit, but overall it remains optimistic that opening up the city a bit more and becoming a little bit more active with our business activity seems very reasonable. We see that happening within our own hospital system, with endoscopies and the colonoscopies increasing. But we remain vigilant about that. Patients won't wait in the waiting rooms. We'll keep our waiting rooms empty. They'll be paged or texted to come in from their cars. They'll come in individually. They won't have anybody with them unless they have a care provider need with them. We'll be cleaning surfaces frequently. We'll be keeping people socially distanced, both in the work environment as well as the patients that are coming through. This is the way that we're going to be working for a while until we get our hands wrapped around how to treat this better or get a vaccination or have enough herd immunity. We're not there yet. So the new normal as businesses open up remains socially distanced, wearing your masks, cleaning surfaces frequently. This is the mantra that we've been saying repeatedly here, and we hope that everybody will stay vigilant to, so we can avoid other hotspots. I think a lot of people are getting a bit tired of this, and I understand that very much. I feel that way sometimes myself. But we must remind ourselves that this is not so much for ourselves, if you feel like you're a healthy individual and that you could weather this reasonably well, but it's for those around you that are at risk. So please stay vigilant. Please stay on top of what we're asking you to do. Stay focused, and we can get things going more towards the new normal quickly. So, thank you. I'll take any
All right,
questions.
Dr. Wilson, I've got a question for you. Do you think if the Midland-Odessa area reopens its economy too quickly, more hotspots like the Midland Medical Lodge will appear?
I think it's got less to do with how quickly things open up than it does with how we open up. And go back to what I've been saying, if we're socially distancing, wearing the mask, cleaning surfaces frequently, it's going to slow things down in the sense of the level of efficiency that businesses will be able to obtain. You're not going to be able to congregate and stand in line close together, et cetera. So it's going to change patterns. So I guess in that context, yes, I think it will slow things down a bit. And if we tried to go back to absolute normal from several months ago, that would have an impact, a negative impact. But if we do things wisely, and I think that's the way the city is aligned to do that, I think we can avoid the hot spots, particularly if we're careful around that vulnerable population that we are focusing on now.
I have a question from Facebook. Are you taking out-of-state patients such as Southeast New Mexico?
We have historically been a facility that does receive patients from surrounding areas when there's need. Southeast New Mexico would not generally be a place that transfers to us. There's other intervening hospitals that are like-sized or bigger. But if they are overwhelmed or if they don't have bed capacity, we are obligated. Our mission is to take care of patients, and if somebody calls in need, we will take their patients.
We have another question from Facebook. Are cloth masks effective, and what type of mask is most effective?
So the question about masks is, it depends on what you're trying to accomplish. So if we're asking our citizens to wear masks, bandana, t-shirt over your face, anything that will dampen water droplets and breath from expanding around you. So this is to protect those in your environment from you, not to protect you from the environment. In the healthcare environment or around somebody that might be infected with COVID, it's very important to be using masks of a higher quality. Water droplet protection masks are of a certain level that you see a lot of surgical shows, et cetera, that you see people wearing. And then there's a higher quality, what we call respirator masks, that are used in circumstances where there could be aerosolized materials. So depending on where you're working and what the environment is and what your goals are with the masks are very effective at accomplishing exactly what they're meant to do.
Okay, we have one more from the MRT. Stuart asks, who ultimately made the call to test more residents at the lodge late last week?
That was, I think, a combined decision between Midland Health and the health department. When we recognized that there was a hot spot and there's a bit of an outbreak there, it became apparent that it would be important to do the contact tracing, essentially to track down anyone or any resident or any employee that might be infected. And since we weren't aware on the front side who those might be, we thought it was important to test throughout the facility. What we've seen in literature from other sites, when there's an outbreak of this nature, testing comprehensively gets you on the front side of it more quickly. I think there was a question earlier about testing in sites where there hasn't been any outbreak, and I think Russell's answer was spot on, that there's no benefit really to testing widely in a place where you don't have recognized disease.
What are the main factors that cause so many people at the lodge to become infected?
Well, I think it's you have start off with some employees that most likely an employee that was infected early on. I think we're about 10 days or 14 days ago, there was an employee that was identified. They were working outside of the clinical environment, but it's likely in retrospect that there may have been some contact with somebody who worked in the clinical environment, and that led to it getting into the care facility. And once it's in the care facility, this is a very transmissible disease. So I wouldn't want to say that the population there is more vulnerable to getting it, but once once the contagion is in somebody, the likelihood of getting sick is higher in those that are more vulnerable and elderly. that answers the question.
We'll give them just 1 second to see if there's any more.
Okay, thank you.
Thank you, Dr. Wilson. We'll now turn over to the health department, so give us just 1 second. All right, Whitney, whenever you're ready.
Can you hear me?
Yes.
Okay. Alrighty. Yeah, I can see me. All right. I will give the updates on the confirmed cases that we have. Right now it's at 64. Source of exposure, 13 are related to travel, 42 are related to a case contact, 9 are from community transmission, and 0 are still under investigation for that category. In regards to gender, there are 25 male, 39 female. In the age groups, we have 6 that are 0 to 19, 16 that are 20 to 29, 7 that are 30 to 39, 5 that are 40 to 49, 9 that are 50 to 59, 3 that are 60 to 69, 8 that are 70 to 79, and 10 that are 80 and above. In regards to our patient status, we have 5 cases that are in the hospital, 14 that are in a nursing/rehab facility, 15 that are isolating at home, 2 that have completed their isolation, 25 that are recovered, and 3 deaths. For medical visit, there are 21 that were tested at the drive-thru, 11 in a clinic or private provider, 6 at the emergency room, 9 in an inpatient setting, and 17 in a congregate facility. For the investigation status, we have 42 that are ongoing and 22 that are complete. We added the congregate facility option for medical visits because of the testing that happened at the medical launch last week. All right, I'm open to any questions.
Okay. Can you walk us through the timeline of the outbreak at the Midland Medical Lodge?
So we had an administrative staff that tested positive on the 3rd, and then additional administrative staff that tested positive on the 4th. I believe the 4th had 2 cases, the 7th had our 4th, and then when we had our first resident case, which was last week, is when we decided to do the mass testing as well as speak with the facility about their isolation wing. And so they did assure us that they had the isolation wing to put their positive residents. And then again, we had the testing from MCH and also additional testing for everyone else by Midland Memorial on that Friday. And here we are today.
And I know this was asked by Mish before. Can you, hold on, let me get back to it. Can you tell us the number of residents and staff who live and work at the medical lodge?
Sure. There are a total of 28 cases associated with the lodge. 8 of those are staff and 20 are residents.
Okay. Can you elaborate more on how the residents at the lodge were isolated once cases started appearing?
Sure. So once we started our investigations with the Midland Medical Lodge, which we have been in constant communication with them from day one, they assured us that there were no visitors coming in. It's just the residents that were there, and of course staff that had to come in to take care of them. Once the staff was, or once the resident was identified as being positive, we spoke with the lodge. Essentially have isolation wing in place at that time. So they were able to move the patient there, and they have about approximately 30 beds on that wing. So they're able to isolate the patients that come back as positive, and they currently have an area where people that are negative but may be symptomatic, they can also place them in an extended isolation wing.
And then a question from the hospital's Facebook page. Is it necessary to wear gloves when shopping?
So the CDC recommends that you wear a face mask. Now, by no means is that a mandate, but if you want to prevent any type of transmission, any type of mitigation step or process, where it being a mask or gloves is recommended. And definitely washing your hands and having hand sanitizer on hand will help.
And is the health department checking on all nursing home assisted living facilities to make sure they're following procedures correctly?
That's actually a great question. We're working on gathering that list right now. I've been in contact with the Texas Health and Human Services Commission to make sure we have our complete list of our nursing and rehab facilities for Midland, and we're going through that list, and we're making sure we have points of contact, make sure they know what forms need to be filled out in case there are any positive residents or if they have any questions, and we also make sure that they're going to be referred to reputable sources, which will be the CDC's website as well as the Texas Department of State Health Services website.
And this one is from the MRT. Do you consider the larger amount of testing at Midland Medical Lodge earlier? Maybe did. Did you consider the larger amount of testing at Midland Medical Lodge earlier?
Can you elaborate on that question? I'm not sure what they're asking.
I think he's wanting to know, did you maybe think about testing the larger number of the staff and residents there before Friday?
No, and I believe Dr. Wilson hit on that question as to the rationale behind why we tested when we did.
And Mitch with Marfa Public Radio is asking, once multiple staff members at the nursing home began testing positive at the beginning of the month, should the hospital have been notified, and should there have been mass testing?
Can you ask that again? I'm sorry.
Once multiple staff members at the nursing home began testing positive at the beginning of the month, so the administrative staff members, should the hospital have been notified, and should there have been mass testing?
Yes, the hospital was aware of the positives. It wasn't something that was kept secret. Midland Medical Lodge, the health department, as well as the hospital have been on the same page since the first positive. We all had open communication.
And then the second part, which I know you touched on last press conference, but if you can just reiterate, it said, should there have been mass testing earlier?
No, there weren't. There were positives just with the residents, and as we said before, there wasn't any reason to test the patients, especially, or the residents, especially since none of them were positive. Once we did get the positive resident and they are in a congregate location, that's when we decided to do the mass testing.
Oh my gosh. Were any staff from Midland Medical Lodge working at any other facilities?
No, they stopped sharing the staff members once the governor put the changes in place for the nursing home.
For those who have family members at the lodge, what should they do? Are they safer in the lodge, or should they be moved out?
Oh my God.
The lodge has been in communication with the family members since our first staff member became positive. So family members have been aware, they've been made aware, and they have been communicating with the lodge. Now, with the patients that are, the residents that are in the lodge currently, it would benefit them to stay there, as most of them are there because they need additional care that maybe their family members are not able to provide. So the staff that is in the lodge is in place to be able to provide them with the additional or ongoing care that they need.
Okay, and for the sake of time, so we can get through the rest of our speakers, this is going to be the last question for Whitney. It comes from CBS 7. How many residents live at the lodge? Can you give us a sense of the ratio of how many are sick compared to healthy right now?
I believe they have 120 beds, and they have about 80 residents currently.
Okay, well, this will be the last one because that was a quick answer for you. Midge asks, how does the health department believe the virus spread from admin staff to the residents? And how many residents have respiratory issues or underlying health conditions that put them at a higher risk?
So I don't remember what the first question was. Again, that's something that I believe Dr. Wilson hit on pretty good. With the first staff member being in a non-clinical area, there's still the potential that clinical staff came in contact with that person. He also touched on how transmissible this virus is. So somebody could have come in and picked up paperwork or other means of transmission. You know, they could have had a conversation while they were passing by in the hallway, and that being a clinical staff could have been spread to those that are in the resident populations. And as far as any underlying conditions, I believe that would be a question that might be best suited for the lodge itself. As you know, this is a facility with several individuals that need ongoing care. So several of them, if not all of them, have underlying conditions. To be able to pinpoint which ones are specifically respiratory versus cardiac or any of the others would not be something that I would press upon right now, or touch upon right now.
Okay. Thank you, Whitney.
No problem. Thank you.
Katie, whenever you're ready.
All right, good morning. I'm Katie Atkins, Chief of Staff, Midland ISD. A few updates from the district. On Friday, we heard from Governor Abbott in regards to school closure for the remainder of the school year. At this, Texas schools are closed for the remainder of the school year. As much as we might have been anticipating this, we realize it is still a lot for our students, our staff, our community to take in. Forces us to confront this new normal. So of course, you know, this raises a lot of feelings at this point, and it's okay for us to all have these various very conflicting feelings at this point in time. I do want to take this opportunity to remind everyone that we have stood up some resources in terms of counseling available to our community. They're either available by calling directly to MISD counselors or to Permia Care. Our MISD counselors are available Monday through Friday, 7 a.m., 7 p.m. via phone at 432-240-1439. The Permia Care counselors are available at all hours and can be reached by phone at 844-420-3964. We have more information that has been stood up on our website at midlandisd.net/COVID-19. Couple of other talking points that I do want to address. Last night, our school board met during the board meeting to pass a resolution addressing class rank and GPA for the class of 2020. For the class of 2020, only the GPA and class rank up through the fall semester of 2019 will calculate towards their GPA. We realize that this is definitely a break from what we've done in the past. It's consistent, though, with what we see with a number of what other districts are doing. We feel that this is something that is the most fair to our students by including what was normal at the time that we were in school. So this also brings us to conversations about questions and answers to valedictorian, salutatorian, and top 10%. So the determination of these honors will follow suit based upon those grades available through the most recent fall 2019 semester. We also want to address a couple of questions about summer school and summer learning. We're really talking about not necessarily summer school, but summer learning opportunities. At this time, we are not altering our start dates or end dates of our school year. There's been some suggestions that students all be brought in for mandatory summer school. We realize that is not going to be possible for all students. So we're looking at how we're going to deliver summer learning opportunities for several different groups of students. First of all, students who are in danger of falling behind based upon what we see from the fall semester continuing on to the spring semester, and then also what our students might want in terms of enrichment. And again, this would be something that we're focusing on students who elect to take that. So we have enrichment opportunities for students who would want to continue with some further opportunities and learnings of various regards. So that will be an opportunity that we will be sharing, and our team is still working towards developing that, as well as opportunities for students to receive further support based upon the data that we've had from the fall and then also moving into the spring. So as this gets worked through, you can expect more information through our website, and also our campus principals will also be sharing that as well. I also want to touch on graduation. Graduation, based on everything that we know at this point in time, it will not be moving forward in a traditional manner. It is going to be, a large part of it will be virtual. I know this was a difficult decision for us to make, and we really did not come to it lightly. But as we would love to do a traditional in-person graduation, we can't in good conscience put our students and our families at risk for COVID-19 transmission by subjecting them to a traditional graduation setting. What we will do is that we will honor our students. We realize they've worked hard. We know that they have been in a situation that has been very abnormal, and this is not at all what parents or students expected at this point in time. So we will honor our students, we'll honor our graduates. We'll definitely share that information out in this week, moving into next week. So that information, we also have a section on our website that is dedicated to our seniors. It is midlandisd.net/seniors2020. We continue to update that information as well, but specific graduation information will be placed there, but also further information will be coming from your campus quite shortly. With that, I'll go ahead and take any questions that anyone may have.
From the MRT, they are asking, will students in danger of falling behind be required to participate in summer learning?
So there's no way that we can make students come to summer learning, but what we can do is we can reach out to those families and say, this is the situation, here is what we can provide to you, but we cannot make someone come to summer learning.
We'll give them just a few seconds to see if there's any more. And MRT is asking, was an outdoor open air graduation considered?
A number of things were considered. Open air, distancing 6 feet apart, a variety of things were considered. But when we consider the fact that we have this in our community, it's a very transmissible disease, our first and foremost priority is to make sure that our students are healthy, that our families are healthy, and that our community is healthy. We realize that Midland ISD plays a major role in public health based upon what we do and do not do. And so taking that into consideration and the care of our community and our students and our staff, our parents, everyone involved, we felt that this moving towards a virtual possibility would be in the best interest of public health at this time.
Katie, that's all we have. Thank you.
Thank you.
Terry, you're good to go.
Okay, good morning. Last Friday, Governor Abbott laid out his initial plans to get this state and our economy back up and running. He opened up elective medical procedures as long as they don't dilute the available medical facilities to deal with this virus. He opened up state parks, and he put in place a retail to go starting this Friday. This last initiative to me is the most important announcement he could have made. President Reagan coined the term trickle-down economy, and this one action is going to kick-start so much for so many. If you're in retail, figure out a way to provide your product to us as safely and humanely as possible. This will help us. This will help you. It'll help your employees and your suppliers, and in short, it will help our entire Midland community. Governor Abbott also promised to roll out more initiatives on the 27th of this month that could possibly kick in by May 4th. This will undoubtedly begin our return back to normal. We got some really bad news last night, as Russell Myers just reported. We've had a significant increase in the number of cases in Midland. And ironically, just yesterday, I've been reviewing data from the state that said we might be coming out of this. So as you see, this is day to day. But if ever there was an opportunity to beat this thing, opportunity is now, and that opportunity rests with each of us. So my comments today are very simple. First, I want to thank everybody on the front lines of this fight. The work's getting harder, I know it is. But we need you, and we appreciate you. Most of you are keeping your distance and staying at home. This helps, but we also need more information about how you're feeling. If there was ever a time when you could thank everyone on the front lines, if there ever was a time to show your appreciation to all those taking on the fight, it would be to wear a mask, practice social distancing, and if you would, please consider joining chat. Right now, we have over 900 people that have taken part. It's amazing. We were hoping to get 1,000. We're almost there. So thank you. About 3.64% of you are reporting having symptoms. So today, in the next 5 minutes, get 10 of your friends to text chat, C-H-A-T, to 432-287-7337. And those are my comments. If there's any questions, I'd be glad to answer.
All right, we'll give them just a few seconds, see if they have any. Judge Johnson, thank you.
Thanks.
Mayor Payton?
Thank you. I want to know why Terry Johnson always gets off scot-free with questions. So I want to begin by just once again thanking all of you for taking the time to catch up. And I want to compliment our health department and our hospital, the work they're doing. It's important for us to remember that we started using this word, that this is a fluid situation, and our health department and our hospital didn't go to college and didn't go to medical school to probably deal with what we're talking about and what our nation is dealing with, what our state is dealing with, and every day brings pretty much a new experience that they're having to work through. There's nothing predictable. There aren't models they can follow, and information that comes out of one state may not be applicable to what's happening here. Information that comes out of another city may not be applicable to here. So everybody is really doing a great job. I know they're doing the best that they can possibly do. And so thanks to them, and thanks to everybody involved in this, from the press corps to hospitals to the school district. Who would have imagined that a school district was going to have to determine whether or not to have graduation, what that's going to mean to multiple kids. That goes all the way to colleges not being able to have graduations. Countless brides and grooms who are having to reschedule weddings, and they don't even know when they can reschedule a wedding. So hopefully, just with me reviewing this, everybody realizes we're all attacking something very fresh every day. Thankful for what the city is doing at the city level. We have meetings. We have some meetings later this week. We have a council meeting next week. Our city staff is doing a tremendous job preparing budgetary changes and things we're having to adjust to, as well as projecting where we think we might be with tax receipts, sales tax receipts, where we might be related to what our economy is doing. So our city staff is as well adjusting to this new season of a reality and what that's going to mean for us. The council is working hard. Council members have been working hard related to other areas of the city, and really just doing a great job as we try to prepare for what's next. That leads me to this whole issue of where are we, when are we going to open, what are we going to do? I am thankful for Judge Johnson telling you what the governor did last week. There was a little bit of, quite frankly, frustration in the sense that I think we were anticipating a little more direction. Hopefully that will come this Friday. I know there's a lot of tension on all sides because there's a little bit of tension of could we open too early? What does opening too early look like? What could it do to us? And I know that's balanced by an equal tension that says, just open the thing and let's see what's happening. And so both of those are extremes, and that's really what we're dealing with in this entire situation. Is rarely is anything not an extreme. So we've got to figure out how to stand in the middle here and not make either side happy. But I can tell you that I've had the privilege of working closely with Mayor David Turner over in Odessa as well. Mayor David Turner and myself and others have been working with other West Texas mayors. We have had the opportunity and the privilege to be invited to present a bit of an opening plan, so to speak, to the governor and to his task force. And there are some other task force initiatives that I've been invited to be a part of, as well as the mayor of Lubbock and others, to put a plan together to reopen Texas. And so hopefully our plan, I'm assured that our plan that we put together has been put in front of the governor for consideration. But even with that being said, I just want to make sure you hear me say that even with the 27th or the 24th, this Friday being something new as far as retail to go, I want to just, I don't want you to get too optimistic of anything happening substantial before May the 4th. And I don't want us getting too excited about anything happening that's not going to be slow. It is going to be a slow open. Businesses have a responsibility as we go through this opening process to not abuse the opportunity. You need to apply the same discipline in reopening as you applied in shutting down. And I know there's great tension and great anxiety related to that, but businesses have to continue to practice social distancing, helping us with keeping people in that discipline, as well as masking and gloves and so on and so forth. You all know the right things to do. There'll be a lot of best practices we're going to have to work through. I received emails from the state yesterday in this committee that I'm involved in, at least 7 pages of things to consider as we reopen the economy. I wrote in my notes, we are quite frankly at the city level, and I don't think I'm speaking out of turn for Judge Johnson, we're actually planning somewhat blindly. There's nothing we can really respond to other than we know everybody wants to open things up. We're waiting for some guidance from the governor, and we will open as much as we are allowed to, but in a consistent manner and with a plan. So with that, I'll open it up to any questions that people might have.
The first one is, will you encourage businesses to have a larger online presence?
Well, I'm not trying to be short with this remark. I think every business is probably already trying to figure out how to increase their online presence. And that's a little more difficult for the smaller, quote unquote, mom and pops that are operating here in Midland and that are getting destroyed by some of the larger big box and Amazons. But I do think it's a good idea for the small businesses to try to have an online presence, but also realizing in this day and time when their revenues have been literally hammered, they may not even have the necessary funds available to go as online as they need to be. It's a great idea. I hope they're able to do it, but it's just the nature of the times make it very tough.
And Mitch with Marfa is asking, are you talking to rural community leaders in places like Presidio, Alpine, Marathon, or Marfa? Are you worried that if Midland's economy is open too soon, that could increase the spread of the virus in smaller communities with less resources?
Well, there's a lot. I think there's some assumption in that question. I don't mean negatively, Mitch, about people traveling to Midland or to Odessa to take care of their retail needs and their shopping needs, and then others who could be traveling from Midland and Odessa. There's so many unanswerable variables to that question. We don't know what the traffic is back and forth. It's one of the reasons why I've tried to work so closely, and Mayor Turner has reached out to me constantly to make sure Midland and Odessa are at least close in how we're planning to reopen. So we're not opening ourselves up to something worse than we might have expected. The first part of your question about whether or not we are talking to more rural communities, not really. Quite frankly, we are considered in the eyes of Austin a rural community, so we're actually marketing in that regard to try to make sure that they understand the importance of what's happening here. But not one-on-one talks. I have been in some phone conversations with the Permian Planning Commission, just listening to what their plans are. But hopefully, if we continue to open in a slow manner and understanding that even the plan we presented to the governor is a very slow, open process. It's not something where we just say, okay, folks, practice best practices and let's open the doors. It's a slow, measurable process that's really in quarters, that's going to take several weeks, where we will be tracking alongside the health department and the hospital to make sure we have the ratios correct as we continue to try to find a way to open.
Okay, let me see if anyone else has anything.
Did I answer Mitch's question?
I think so. Okay, Mayor Payton, thank you.
Thank you all very much. Have a good day. Thanks, Aaron.